There's a remarkable new report. It was published in the Journal of the American Medical Association's Internal Medicine, talking about how privatized Medicare Advantage plans. This was, keep in mind, this was George W. Bush's big thing in '78 when he ran for Congress. Unsuccessfully, he ran on a platform of privatizing Social Security and Medicare. In 2003, he got what he wanted with Medicare, creating the modern version of Medicare Advantage. In 2006 or 2005, after he won re-election, he had a 25-city tour plan to pitch turning Social Security over to the big banks in New York. He got about 10 or 12 cities into that and had to pull the plug because of the blowback he was getting. But Medicare Advantage privatization rolls on, and the consequences are consequential. On the line with us is Dr. David Himmelstein. He is a distinguished professor at Hunter College, a lecturer at the Harvard Medical School, a research associate at Public Citizen, and co-author of that report I was mentioning, this new report about Medicare Advantage and what it's up to. Dr. Himmelstein, welcome to the program. Tell us, first of all, what motivated you to write this report? What led you to the research and the discoveries you found?
Hearing from colleagues and patients the ripoff that Medicare Advantage is really perpetrating on the American people, and seeing some of the data scattered elsewhere. So we thought putting it together and looking deeper into it would be worthwhile. And it really was shocking that the extent of the ripoff is quite astounding. They're taking $82 billion in extra payment out of Medicare last year, over and above what it would have cost Medicare if those people who had enrolled in Medicare Advantage, these privatized Medicare plans, had stayed in traditional Medicare. So tens of billions of dollars each year. So
the two big deficiencies that Medicare has, the first, the 20% that it doesn't cover, which was a demand of the Southern conservative Democrats to go along with LBJ's plan because they didn't want poor black people to show up in hospitals. That 20% was supposed to be a barrier to keep the riffraff out. And then Medicare not covering, some aspects of human health, vision, hearing, stuff like that. The Medicare Advantage plans kind of solve both those problems for a lot of people. Tell me, if this $82 billion in this last year, or the $612 billion since 2007, if that had remained in Medicare instead of going into the pockets of the executives in the healthcare industry, or health insurance industry rather, would that have been enough to close those two holes in real Medicare and fix it?
It clearly is enough. You could give everybody comprehensive vision, dental, hearing coverage, and eliminate the copayments and deductibles from traditional Medicare if you just weren't overpaying the Medicare Advantage plan. So it's the way to actually fix the Medicare program. But doing that means kicking these private insurance plans out of the program.
Yeah. Are you still with me?
I am.
Oh, okay. Yeah, I thought I might have lost you for a second there. So, I'm guessing, given how much money is involved, I mean, we're talking about, basically making off with $82 billion. And, ever since Clarence Thomas was the deciding vote, the tie-breaking vote in Citizens United in 2010, we now have legal bribery of our politicians. And so I'm guessing that industry is going to be really, really hard to stop in Congress. So what do you think about, what kind of a lift would be involved in basically ending Medicare Advantage, or at the very least, I mean, Mark Pocan and Ro Khanna have a bill that simply would forbid these companies from using the word Medicare in their advertising and in the names of their products.
Well, you're right. It is a lift, but they're stealing money from tens of millions of seniors and, frankly, from tens of millions of other taxpayers as well. So the question is, can the American people be mobilized to overcome an enormous and powerful lobby? And yeah, companies like United Healthcare, which gets more than half its business now from Medicare and Medicaid, they're going to fight tooth and nail to keep that business and those enormous profits, tens of billions of dollars each year in profits that they get from those public programs. But I guess the question is, do we have any vestige of democracy left in our country we're mobilizing the American people can overcome those kind of powerful private interests.
Yeah. I mean, inevitably, when I talk about this on the air, and I've written extensively about it, and it's a topic that we revisit constantly. A lot of our listeners and viewers are very, very upset about this. I will always inevitably get a call from somebody who says, I only make $800 a month on Social Security, and I'm retired, and I can not pay my rent and pay $200 a month for Medicare, plus $300 a month for the Medigap insurance. So I had to go with the Medicare Advantage plan. How do we communicate to people that, ending Medicare Advantage would allow us to actually fix Medicare? I mean, the complex arguments like that tend not to do well in American political discourse.
Well, I'm not a savvy politician, I'm afraid, but I can tell you that for my patients, it's pretty simple. If you join Medicare Advantage, it looks good when you're healthy. And then when you get sick, they won't let you go to the doctor you want to see. I can't refer you to specialists when you get a particular problem that needs specialist care. I can't send you to the top hospitals and doctors. And often they just say no when you need a test or a treatment. So what they're doing is they're giving what looks like a good deal up front, but turns out to be a bad deal once you actually need the care.
Yeah.
So I guess the question is, can we really communicate both that we can fix Medicare and that Medicare Advantage, these private plans, look good until you need them? They're like a hospital gown. They look like they're coverage from the front, but once you turn around, turns out there's nothing.
Great metaphor. I had a physician, a medical practice here in Portland that I was a patient in, and they got sold to the practice itself, which had several offices around the city, got sold to a hedge fund in New York, which was also a major investor in one of the big insurance companies, health insurance companies that has a Medicare Advantage plan. And basically, I was informed when they were sold that if I didn't switch that they were going to switch me to Medicare Advantage, unless I made a lot of noise or quit the practice, basically, and went and found a different doctor, which is what I ultimately did. How widespread is that practice?
Well, practices like that are certainly very widespread. United Healthcare, the biggest health insurance company and also the biggest Medicare Advantage company, owns 90,000 doctors' practices, or as what they call a close alliance with those doctors. So
wow.
They basically control those doctors. That's 10% of all the doctors in the country. And other big Medicare Advantage plans also are buying up doctors' offices and doctors' practices around the country. So we're seeing giant corporate players who are the insurer and owning the doctors, and to dictate whatever is profitable for them, both in terms of requiring the patients to sign up with the insurance plan, but also strong-arming the doctors to do what's best for the insurance plan. So cutting corners when they provide or advise care, and also what's called upcoding, really loading the chart, the medical records, with diagnoses that really shouldn't be there, but add to how much Medicare pays the plan. So that's the scam, really, that these companies are running.
That's astonishing. Dr. David Himmelstein, Doctor, thank you so much for dropping by today and speaking with us. Appreciate it.
Thanks.
And thanks for co-writing this report and getting good word out. Thank you. We'll be back. The DeSantis power grab and the far-right fossil fuel companies and their allies in the Supreme Court. Stay tuned. We got a couple of amazing stories for you. We'll be right back.